All right, welcome back, everybody, on the Health Watch this morning. After spending your holidays with friends and family, you may be concerned about all this talk about a triple-demic during the winter months. So here to talk about this with us is Dr. Hussain, the Senior Vice President and Chief Clinical Officer at Trinity Health of New England. Dr. Hussain, thanks so much for joining us. You're in Thailand this morning, so dedication there. Appreciate you.
Sure, thank you for having me. Yeah, greetings from a hot and humid Bangkok.
Well, we want to check in. Hope you had a nice Thanksgiving, by the way. How do things stand right now at the hospitals here in Connecticut? And when we talk about this triple-demic, I mean, are there concerns growing for the amount of cases that we either are seeing now or have the potential to see?
Yeah, that's a great question. So we have seen cases go up. We've seen RSV go up, especially in children. Across Connecticut, we now have flu that has also gone up. Flu cases are high now in Connecticut. And COVID-19 has plateaued somewhat, which is good. But with these holiday gatherings that we're now in the midst of, and this just Thanksgiving kicked off our holiday season, we may see a rise in cases in all three viruses. So we just have to keep an eye out. Nothing to panic, but people need to take, I always tell the same thing, common sense precautions when it comes to these gatherings and in the weeks to come.
Yeah, good reminder there. And I know there's been some talk, Dr. Hussain, about medication shortages, things like amoxicillin, Tamiflu. We've been hearing about this. Is that something that you've been seeing at the hospital level, and sort of what's the strategy to procure more of this medication?
Yeah, we've seen reports of shortages in some parts of the country. This is probably due to the fact that RSV hit us early. Usually it's January, February timeframe. It's here early, as well as the flu, which is here 4 to 6 weeks early. Now, amoxicillin and Tamiflu in some parts of the U.S. have been noted to be short in terms of supply, but there's nothing to panic about because there are alternatives, especially to amoxicillin in the form of clindamycin and other antibiotics. So the FDA does expect some of these antivirals and antibiotics to be in short supply in certain parts of the country in the weeks and months to come, but it is, while it's concerning, there's no reason to panic.
And Dr. Hussain, finally, I mean, are there any tips that parents should know, as we head into this winter season? What do they really need to look out for here?
Yeah, absolutely. So first and foremost, the importance of vaccination, especially now that we have the bivalent COVID-19 booster, we have the flu vaccine available. And folks, if they already haven't gotten the flu and COVID-19 booster, this is the time to get it now as we head into Christmas and other holiday and family gatherings. And also, it's not a bad idea to get tested before a gathering, rapid home test 2 hours before a gathering. And then also, if you're traveling, consider wearing a mask, especially in an indoor crowded situation.
Dr. Hussain from Trinity Health of New England joining us this morning live from Thailand. Again, we appreciate you and all your advice so much. Hope you had a great Thanksgiving. Thanks so much.
Thank you. You as well. Thanks much.